Dr. Raghav is there. Please come. Topic is evaluation, visual outcomes after a lenticle procedure with the novel ELITA femtosecond laser system. Now, Dr. Shroff was
Yes, sir. So what he presented was the limited market release. So I am going to present the results on the clinical study that was done, sir.
for a longer period.
Yes, so they were the first. These are first in world results. So thank you, judges. Good afternoon, everyone. Today I'll be talking about evaluation of visual outcomes after lenticle procedure with a new novel femtosecond laser system. I have no financial disclosures for this particular presentation. So the ELITA is the new system by Johnson & Johnson. So I am going to tell you, my slides are not moving over here. Yeah. Okay. So this has a proprietary new biconvex lenticule. Till now, the lenticules that we have, they are all plano-convex. That is, one side is a refractive cut and one is a non-refractive cut. But here we have both sides that are refractive. So that is going to be advantageous. How, I will tell you. So these are all text. I am going to describe how this translates onto a surgery. So what's happening in basically in ELITA is that we are making, the slides are not moving over here. Slides चल नहीं रही हैं. यहाँ चल रही है, वहाँ नहीं चल रही.
This platform. उधर से try करो.
Sorry.
Same.
चल नहीं रहा है यहाँ पे. ठीक. Okay. Yes. So this has a biconvex lenticule, that is both the sides are refractive. So what is essentially happening is that if you look at this image on the right, you're going to see there are very small packets of energy spent from the laser and they are spaced very close to each other. In a sense, we are making a very small spot size, that too with a very high energy, that too kept very close. That too for a very short duration of time. On the left, you can compare the ELITA, that is the yellow, with the green, that is the Visumax, and the blue, that is the IFS. So you see for a very short duration, we have that energy pulse. So this is all images. I'm going to show you a video. So on the left, you will see how the current lasers are. You will see these are small holes, bigger holes that are spaced well distantly. But now on the right, these are very small holes that are placed very, very close to each other. So if you see on the right, how when we are tearing it, the edges are all ragged. But on the left, once you tear this, it comes out very beautifully and the edges are very, very clean. So that's essentially how the ELITA is working. So now Silk is the name of the surgery. So this is a next generation lenticle platform. Right now only lenticules are being done. We don't have Intacs or any other platform for now. We do also have flaps. We are going to do myopia, that is from up to -12 diopters, and cylindrical powers up to 5 diopters. So the advantage is that once you dock, so this was Rushal also showed you, the advantage that now we have is once you dock the patient, so if you see we can center the lenticule within the docking, and also we can align it with the 0 and 180 so that we have a good cytotoxin compensation, and also we can center the lenticule on the pupillary axis. We ask the patient to look into the center of the microscope and we mark the visual axis. So till now the platforms are not working on the visual axis, but now this is. Now this I'm going to show you now, that as the laser is working, we go into the green zone and then we can easily do a slight cytotoxin compensation. We see the 0, 180 and we can center we just did the compensation and the lenticule can be moved. And once the laser fires, this is one of the procedures. I'm going to just go through it. This is under AIOC guidance. So once we fire the laser, it's very easy to find the planes and the lenticules. And once you see that we go in the anterior plane, you can see on the right with the AIOC that we have gone inside the anterior plane. So the advantage we get over other platforms is that because of very small spot size, the dissection is very, very smooth. And the lesser the time is spent inside the cornea, the better we are going to have results and better the corneas are going to be. This also translates onto the results. So the study was done in 2 centers. We started in 2020 January in the Center for Sight, and then 2022 Narayan Sale also joined in. So we had a total of 170 treated eyes. We did lenticle creation in both eyes with the same platform. More than 18 years old patients were included, and refraction up to -12 and cylindrical up to -6. Just take one more minute. And this is all patients were 20 by 20 or better at 6 months, and all patients were within ±0.5 of refraction within one month. and all patients were 100% 2020 at 12-month visit. So initially the patients were being undercorrected a little bit, but then we had 2 nomogram corrections, and now patients are hitting 2020 at 1 week post-op. 91% patients required no or little dissection. Thank you.
Did you compare with your previous filmed machine? Did you compare?
Okay, so like sir was also saying, so as of now we are under the process of doing a head-to-head trial between the Smile and the Silk. As of now, because there are lots of, I would say, ethical implications, because there are 2 different laser platforms, but now it has been submitted, and once we start doing the trials between the Silk and the laser, that will be the first trial of head-to-head between 2 lenticule platforms. The only issue right now with the Silk right now is that we are doing a very hard dock. So once we dock the eye, we have very bad subconjunctival hemorrhage for the initial few hours, which tends to increase at one day. But yes, the patient will be able to feel that the Smile eye is cleaner than the Silk eye, but visually, patients are very, very clean. We've done a comparison of the aberrations also, and there are very less induction of higher order aberrations.
Visual recovery is almost equal in both.
Yes. Both patients, of course, they are not documented, but yes, 95% of all our patients are 6 at 24 hours. That is the 1 day post-op. We do have 4-year follow-ups till now, that is the clinical research trials, and they are doing very, very well.
Any regression rate?
I think so it's too soon to say till now.
In a 4-year follow-up?
No, we don't. No, none yet, sir. There was only one patient that had a very high cylinder. That patient is expecting a minus 0.75 cylinder, but that was told to the patient, and yes, but otherwise the results for astigmatism till now have been immaculate, because we have the compensation of the cyclotorsion.
Thank you.
Thank you, sir.